and welcome. I'm Sonal Mehrotra Kapoor and you're watching Health and Wellness Myths and Facts. Now, the term heart disease refers to several types of heart conditions. While most of these conditions are preventable, heart disease is the leading cause of death in both men and women globally. Indians develop a heart disease 10 years earlier than those in the Western countries. And nearly 3 million individuals die from stroke and heart attack each year. The most worrying part is that amongst the heart attacks, 40% are below the age of 55. In young Indians, higher rate of heart diseases are due to both inherited genes and environmental factors. Unfortunately, these environmental factors have only worsened the risk over time. Stressful jobs, working long hours, have become the new norm in our lives. Even the lack of physical activity and eating a lot of processed food has contributed to the increased heart diseases. The COVID pandemic further has exacerbated the cardiovascular disease burden. When people are informed about the risk factors, they can take precautions to manage their symptoms at the earliest and reduce the risk of heart attacks, heart failure, stroke, or a sudden cardiac arrest. Yes, there's a difference in all of that. Now, on the program today, we've got experts for you with us who give us the correct guidance about heart disease prevention and its management. If you have any questions, you can also ask them. All you have to do is send your question on the WhatsApp number that's flashing on the screen right now. I'll repeat it for you once. 9167 666 941. It's 9167 666 941. You can send in your questions through WhatsApp. Do follow it up with your name and location, so we'll have our experts answer them for you. With that, let's introduce our panel of doctors. We've got Dr. Siddhant Jain with us, senior consultant and interventional cardiologist from Indore. We also have with us Dr. Tarun Dave. He's an interventional cardiologist, Krishna Heart Institute, Rajasthan Hospital, also goes to the Sai Hospital in Ahmedabad. And Dr. Gurpreet S Wander is with us. He's professor and head of cardiology, Dayanand Medical College and Hospital at the Unit Hero DMC Heart Institute in Ludhiana. Thank you all for joining us on this very important conversation. Dr. Jain, let me begin with you first. Now, India is reeling. It's no sort of news or sort of thing that we all do not know already, is the fact that India is reeling under the burden of cardiovascular diseases. Now, do Indians have genetic sort of ways in which we have developed, and that's the reason why Indians are more prone to heart diseases compared to the West, or why exactly is the heart burden more on this side of the continent?
Yes, you have already told a lot about the risk factors for heart disease and how heart diseases are increasing. But we Indians and South Asians are at very high risk of suffering from heart diseases. And one of the important reasons is the genetic predisposition. Definitely, Indians and South Asians have got higher genetic tendency for heart diseases and heart attacks and heart blockages. And there is a different sort of distribution of heart disease. The amount of disease, diffuse critical disease, is much more in Indians. The age of suffering from heart attack compared to the Western population is much younger. In West, people suffer heart attack and heart disease in the age of 55, 60, 65. But in India, we see many young patients, and the average age is 45, 50 years. There has been a study done by IIT Chennai. Almost 750 plus Indians genetic studies, DNA samples were checked, and 35 to 40% of the patients have got genetic variations which increase their predisposition to suffer from heart disease, especially higher cholesterol levels, familial hyperlipidemia levels are seen. But still, majority of the heart disease don't have a very direct genetic correlation, and lifestyle also plays a very, very important part. So we have to think very critically whether it is just genetics or lifestyle and other risk factors which play a part. But yes, Indians are at high risk of heart disease because of their genetic risk factors.
Genetic risk factors, a lot of people think, well, it could be because of our dietary habits as well, but we'll talk about that as the show progresses. Let me take the next question to Dr. Dave. Dr. Dave, post-COVID-19 complications occur not only in people with pre-existing heart disease, but also with people who've had no history absolutely of heart diseases. How has the pandemic, do you think, affected the heart of Indians, and which heart-related complication are you commonly seeing post-COVID?
Well, you know that COVID is a very new virus which has come up in the light in last 2 years. And this virus not only affect, as we commonly know, the only lung tissue, it affects several other tissues of the body, and heart is not an exception. So many times the virus directly affects the heart muscles, and that produces an inflammation or something called a swelling of the heart muscles, reduces its capability to pump. Heart has to pump blood to all around the body, but which is impaired because of the swelling of the heart, which is reflected in ECG. Sometimes patients also get a breathing difficulty, and which is also picked up on certain laboratory tests like say troponin. The doctors commonly get it done. So this is a direct involvement of the heart because of the COVID virus itself. Secondly, even the inflammatory reactions which is triggered by the COVID can also produce an bad effect on the heart. And third is some of the treatment like say steroids are very commonly used, that also hasten the process of precipitating heart problem in such patients. So number of ways it can affect the heart problem.
I see. Number of things can actually, in fact. Let me take the next question to Dr. Gurpreet. Dr. Gurpreet, it is said that sudden cardiac death is responsible for half of the heart disease deaths that take place in India. What are some of the most preventable conditions when it comes to sudden heart attacks and sudden cardiac deaths as well? In fact, through the pandemic, we've had horror stories of young people as young as 30 dying in their sleep with no family history, young, fit people. And so one really wants to understand, are there any markers that even young, healthy individuals need to be watching out for?
That's true. As you were yourself saying that Indians harbor coronary artery disease or heart attacks about 10 years earlier than other civilizations. Sudden death is a very sinister mode of presentation of this heart disease, and that's why everybody is so scared of heart diseases, because as you rightly said, half the deaths because of heart disease could be sudden and they do not really give time. In fact, 25% of these cases could be sudden death could be the first mode of presentation in these patients. So that is the reason that we even otherwise heart diseases are responsible for 25% of the adult deaths world over, because it happens to be the commonest non-communicable disease, and as our population is aging, heart disease is becoming more and more important. But essentially, actually, if you look at people more than 35 years of age, you must have seen so and so was exercising in the gym and died. Some marathon runners died, or as you said, somebody could not get up from sleep also. Now, elderly people, or so to say middle-aged people beyond 35 years of age, the commonest cause of sudden cardiac death is again just as heart attack, although it's not based on a heart attack. But all the atherosclerotic risk factors that are responsible for heart attacks are responsible for sudden cardiac death also. So high blood pressure, high cholesterol levels, central obesity, smoking, substance abuse, positive family history, genetics you were mentioning, and Dr. Jain was also mentioning. There are some families in which these diseases run, and those families are at a greater risk. Then excessive stress and strain, lack of exercise, and Indians have a very peculiar kind of a central obesity where the paunch is more what we call as an apple obesity. So anybody harboring more of these risk factors is at a greater risk of sudden death. But if we talk of people less than 35 years of age, then there are some particular conditions in the heart muscles and also some electrical abnormalities of the heart, what we call medically as channelopathies. So before someone undertakes into extreme levels of exercise like marathon running, one does need to look at the coronary risk factors, but also family history is a very important aspect. And those families where less than 55 years of age people have died suddenly or because of heart problems, they are at a particular risk, and in those people, we have to take special precautions.
Right. But Dr. Gurpreet, I have a follow-up question to that. Then what should young people in these families do when you know that on your paternal side or maternal side, you've seen deaths happen due to heart diseases? Today's youth is very cautious, wants to eat right, wants to follow the right health patterns as well. I'm just trying to understand, are there some signs one can watch out for, some test one should get done to sort of have a better understanding of what's going on inside your heart?
Yeah, that's a lovely question, and in fact, it's an afterthought of what you initially also said. Some families have a higher propensity, higher risk of coronary artery disease. So those, as I earlier said, women are relatively protected as compared to men. They have coronary disease because of the natural estrogens that they have. It presents about 10 years later than men. Men are at a greater risk of sudden death. But extreme levels of exercise, when it is undertaken by people who are at a higher risk, unmonitored exercise, those people are certainly exposing themselves. You must have read recently this new exercise, the bike that is become so popular, and especially when these people enter into marathon running or competitive, the environment of a gym which generates so much of competitiveness in people. So these people need to know their risk factors. And if there are other members in the family, especially those who have had sudden deaths in the family, they need a medical checkup, an ECG, an echocardiography, and a risk factor profile for coronary disease.
I see. So don't overdo it is what your advice is, even in trying to combat it, trying to ensure that your heart capacity might be limited. So be in touch with your cardiologist and then go ahead. That's good advice actually going forward. Let me take the next question to Dr. Jain.
Can I just say one thing?
Sure.
Many studies have shown now that moderate level of exercise for a longer period of time imparts greater health benefits than extremes of exercise, which at times youngsters start taking.
So consistency is king, right? Like that's the key. Do half an hour, but do that every day. That's how your body really adapts to any new form, is what you're trying to say. Something we could all sort of learn from. Let me move on now. In fact, I'm told we'll quickly slip into a break. When we come back, we've got more set of questions for our doctors. You can also send in your questions on that WhatsApp number. Thanks so much for joining us on the other side. Welcome back. You're watching Health and Wellness Myths and Facts, and let's go back to our panel of doctors with more questions now. Dr. Jain, let me come to you next. It is seen that heart attacks are more common in obese people. Could you explain to us the relationship obesity perhaps has with cardiovascular diseases?
Yes, you are very right. Heart attack happens more commonly in obese patients, not just heart attack, all type of heart disease like hypertension, cholesterol, heart failure happen more in obese and overweight patients. And as Dr. Wander has stated, I'll again reinforce, it is not only your body weight or BMI, it is more related to your abdominal obesity. Jisko aap tummy, you say it's your tummy or paunch. If you have got more abdominal fat, that abdominal fat or visceral fat, that is the fat, that is the adipose tissue which creates inflammation and atherosclerosis in the body, and that fat leads to blockages, deposition of cholesterol in blood vessels of heart, even blood vessels of all your body, kidneys and limbs, and even your brain vessels, and give rise to diseases such as heart attacks and strokes and paralysis and peripheral arterial disease. So that abdominal obesity and overweight has got a direct relation with atherosclerosis and heart blockages, and your body weight needs to be maintained very strictly. You should always consider your body weight, BMI and abdominal circumference. How that causes? Because that fat produces inflammation in the blood vessels, and that inflammation increases atherosclerosis or deposition of cholesterols in your blood vessels. So abdominal fat and obesity has got a very direct correlation, and we should be very careful about our body weight and especially our abdominal or tummy circumference.
I see. Moving on now to a similar question, this one related to cholesterol actually, and Dr. Dave, if you could take that. Should a person with heart disease focus on lowering his or her dietary cholesterol or saturated fat to prevent the risk of heart diseases? And how much cholesterol in diet is actually allowed, and what form is the best? We all now have enough understanding of good cholesterol versus bad cholesterol, triglycerides level, everybody knows that by now. But how does one manage that in diets?
True. Well, there was a recent controversy because previously it was being believed that one should not take cholesterol in diet at all. But you see that whatever cholesterol we consume in diet, it doesn't directly go into our blood vessels and get deposited. It first get metabolized. So the cholesterol is not consumed in such a large quantity in everyday life. But what is we are not realizing is the invisible fat which we consume. Like say most of our diet, even the cereal, the pulses, etc., also have some amount of fats. There are visible fats in terms of butter or ghee or vegetable oil or vanaspati oils, which is commonly used in the industrial processes. So our consumption of this visible fat, I would say that it should be reduced. And for a person who had a heart problem, the cholesterol consumption should be less than 300 milligram. For a person who had a previous heart problem, it should be less than 200 milligram. But more importantly, the total consumption of the fat per 24 hours in an adult with a moderate activity should not be more than 80 gram per day. So you see, if you analyze it further, we should reduce the consumption of the saturated fats in our diet. And the best example to have unsaturated fat or polyunsaturated fat is from the vegetables and the fruits like this, without any addition of the visible fat.
I see. That's
This is how
important
the-
to
Yeah.
keep in mind actually. Let me go to Dr. Gurpreet next, and similar question really when it comes to cholesterol. And one wonders if cholesterol actually accumulates right at an early stage. Do people have to worry about high cholesterol levels in the blood only after a certain age? Is it linked, in fact, should we say, to the amount of activity you do and not just your age as well?
Yes, surely, because the basic process of heart attack is, in medical terms, we call it atherosclerosis. And so to say, the seeds are sown very early in life. And what is initially called as a fatty streak, in fact, in autopsy studies in accident victims in for 20s or so, it's been shown that fatty streaks are seen more often in people who have lipid abnormalities to a larger extent. And young people, actually, there are families, as we were discussing earlier, you were also mentioning, and Dr. Dave also said, there are some families which are harboring genes, what we call as familial hypercholesterolemia. And the prevalence of this is not very uncommon. 1 in 500 families have familial hypercholesterolemia. In fact, 75 to 80% of the cholesterol that you have in your blood, as you were saying, we are all aware of LDL cholesterol or total cholesterol. That is actually genetically determined. It's a polygenic inheritance. Only 25% of your cholesterol is dependent upon the diet that you take. You can certainly make a huge difference in terms of how much cholesterol you can reduce with your dietary reduction. But unless a young person knows what his cholesterol levels are and whether someone has a tendency towards hypercholesterolemia, what we call, how would somebody know whether he or she has to take extra precautions or not? So as you rightly said, yes, younger age people, the major cause of heart attack is substance abuse, smoking, and positive family history. Elderly people, diabetes and hypercholesterolemia, these become more common. But it's a kind of an investment any young person makes for a future good health. If you know your cholesterol levels and the kind of diet Dr. Dave just said, one does not consume diet which is very high in fat. I come from state of Punjab, people take a lot of desi ghee, saturated fat. So all these things can make a big difference in terms of their subsequent risk which they have later.
So what I'm understanding from you, Dr. Gurpreet, is get regular checkups done. Know at least what your levels are, even when you're young, to know what your body is currently undergoing and how you have to tackle it. That's one way. When it comes to food, however, I do have a follow-up question. I'll come to that later. Let me go to Dr. Jain first and talk about exercise. How does exercise help in lowering blood cholesterol levels? There is, like I said, good cholesterol, bad cholesterol. There's a huge debate on what kind of cholesterol should we be really working at. And then there is this entire thing. I mean, you know, you were talking about how we need to watch out for food and watch out for how many calories we eat in a day. In India, where food labeling standards are so low, when you're picking up packets and you have no idea what's inside it, even when you pick up, say, cooking oil and you have no idea what's really going inside it, how does one even make these calculations?
You've got a very important question. Exercise and cholesterol levels. Cholesterol, we all know, good cholesterol, bad cholesterol. Good cholesterol should be high, bad cholesterol should be low. And it's actually very difficult for us to modify our diet exactly and understand how much cholesterol is there in the diet. But what we can do very easily, every one of us, we can increase our exercise. Exercise has got a lot of beneficial effects. Exercise, say, you can decrease your cholesterol levels, bad cholesterol level can be decreased, and good cholesterol, that is HDL. There is only one thing, there is no drug available in the market which can actually increase HDL. So only way to do it is to do good regular exercises. LDL, the bad cholesterol, can be controlled by lifestyle, diet and exercise, but there are very good medicines available to control LDL cholesterol, which are drugs or even injections available. But for good cholesterol increase, only thing you can do is doing good exercise. Amongst exercise also, what type of exercise are beneficial? Dr. Wander has already given a hint about the exercises. Regular, moderate intensity exercises should be done on a very regular basis. In fact, the American Heart Association recommends that 4 to 5 days a week, you should do at least 45 minutes of exercise per day, which should include a combination of, cardio exercises, heart benefit exercises like cycling, running, swimming. Plus, you should also have regular, sessions of strength training, muscle building exercises, as well as the flexibility exercises, which we call yoga or stretching. So proper exercise regime according to your age and according to your physical ability to be done regularly, not in spurts, and consistently. That is one thing which can actually give you benefit in controlling not only your cholesterol level, but improving overall your cardiovascular health, decreasing your stroke, diabetes, and of course, improving your musculoskeletal agility. So exercise is the elixir. It is very, very important.
All right, I see. So not just yoga and not just this HIIT, which is the new favorite buzzword these days, high intensity workouts as well. Don't do either of them. Do a combination is what I'm really hearing from all of you as well. I have very little time left. Not sure if we have one time for a question, but if I can come to Dr. Dave very quickly on obesity as an independent risk as well. Can weight loss, that'll be a good question actually end on, will weight loss reverse coronary heart disease? Is that a possibility?
Yeah, sure. See, if you have a healthy diet like exercise and yoga, it will positively affect your process of atherosclerosis inside the inflammatory markers, and that will lead to a regression of the ongoing process of atherosclerosis, or to some extent it will retard or reverse it also. So diet, healthy diet will have a long way if it can be followed continuously. It's not that for 1 month you have a healthy diet and then just leave it to the rest, the diet restrictions. It's not like that. The way of living with a diet is to be changed. And if you can reduce the weight, that will also have the positive impact on your problem of atherosclerosis.
I see. I believe that's all the time we have on the program today. Thank you all for joining us and giving us such valuable information. Everybody can use this information, really young or old, and should be following it. Thanks so much for your time. That's it on Health and Wellness, Myths and Facts.